Hi there, my name is Morgan Lowe and I'm the Women's Health Physio at the Hallamshire Physio Clinic. I just wanted to talk to you a little bit today about pelvic organ prolapse, which is something that I think a lot of people are either told by their GP or a consultant that they have, but perhaps aren't 100% sure what exactly that means and also what options there are to treat that condition. So basically what I'm going to do first, I'm just going to show you sort of what things should look like, the sort of normal status inside the pelvis. So this is a sort of cutaway sideways of the female anatomy. So you've got kind of the front here and the belly, that would be your pubic bone there. At the back there, you've got your spine just coming down here. And this little bit here, that would be sort of your bum cheeks and the sides of your legs. So it's sort of cut in half at a side view. So in a woman, there are three major organs that sit in the bottom of the pelvis. You've got your bladder here at the front, you've got your uterus or your womb here in the middle, and at the back you've got your bowel and your rectum. Now, those organs are all held in place by a big sling of muscles that you might have heard of called your pelvic floor. It runs all the way from the back here, all the way across and fastens on sort of around here somewhere. So if I show you on a model, if this is a pelvis, it sits, it's that pink in there, that big massive bowl of muscles that sits in the bottom of there. That is your pelvic floor. Now, that can become weakened for a variety of reasons. Having children certainly does it, lifestyle choices. There are various reasons, and it is something that just naturally starts to weaken a little bit as we get a bit older. Now, the problem when it comes to pelvic organ prolapse is that if that muscle isn't doing its job and holding those organs up, as I showed you in here, nice and tight and taut, they can start to drop down. And it's when those drop down a little bit that we start to see those signs of what we call prolapse. So there are kind of three main types that I think people tend to sort of hear from a doctor or from a consultant and aware that it's something that's happening to them, but perhaps don't know the difference between them. So probably the most common one that people think of is what we call a uterus or a womb prolapse, where the womb starts to pull down here. So instead of being held up nice and taut there, it's dropping down, and you can actually have an external bulge that you can feel. Often people are aware of it when they're in the shower or when they're wiping themselves, that they can feel that bulge. There is a couple of other types as well. So you can have what we call a bladder prolapse, which is where instead of being held up nice and tight here, the bladder's sort of fallen backwards. And when it does that, that can really affect the way that your bladder works, the way your urinary control is, all those kinds of symptoms. And you can also have what we call a rectocele or a bowel prolapse, where the bowel, instead of being held up nice and tight here, sort of falls forwards the other way. This can kind of lead to bowel type problems such as constipation, and it's often something that's felt more when somebody's straining and struggling to go to the toilet to empty their bowels. Those three types of prolapse are probably the ones that are the most diagnosed, and I think people get quite afraid because it is quite sort of scary terminology that's used when someone tells you that your bladder is prolapsing. I think people are often quite unaware what on earth that means, and does that mean that it's hanging out, and does that mean that it's irreparable and I've just got to live with it? Certainly not the case. There are multiple options for treatment, and the current sort of scientific evidence base does show that physiotherapy is really quite helpful in these instances. The current clinical NICE guidelines that exist really put this kind of pelvic floor training and specialist physio quite high up there in the first line of defence for a pelvic organ prolapse. It's certainly something that we can help with. It's certainly something that we can talk to you a little bit more about and just make it sort of all make a bit more sense. And if it's something that you want to come and have a chat with me about, if it's something that you want me to have a look at and help you to manage it better and hopefully treat it and sort of get it back to the condition that you would like things to be in, then give us a ring here at the Hallamshire Clinic, book yourself in with me. My name is Morgan. I'll certainly be happy to talk to you a little bit more about all of these things, and I look forward to meeting you.